Welcome to Community Conversations. I'm your host, Steve Mantis, and my guest today is Sally Calquhoun, the coordinator of legal services at Kinna Community Legal Clinic. Sally, welcome to the show.
Thanks, Steve. I'm happy to be here.
So, let's start a little bit with your own background. Did you grow up in Thunder Bay? What's
I did actually. I grew up in Thunder Bay, but my parents actually both grew up in Thunder Bay, and my grandparents lived here. So I've lived elsewhere to go to university, and when I was doing my bar admission course before I was called to the bar, but I've been back in Thunder Bay since then. It's a nice place to live. I like Thunder Bay.
I do too. I mean, I didn't grow up here, but I love it here. I think it's just great. So now you're the coordinator of legal services, so you're a lawyer
Yes.
at Kinna.
Yes.
Now tell us a little bit about Kinna Legal Clinic.
Kinna Legal Clinic is funded by Legal Aid Ontario, and we provide poverty law services to low-income people in the District of Thunder Bay. So that's the whole district. We have an office in Thunder Bay, obviously, but we also have offices in Marathon and Geraldton, and community legal workers who travel to smaller communities throughout the district, including a number of First Nation communities.
So the district goes from Marathon to, how far does it go west?
We don't go very far west, but
Okay.
you know, Heimers, Nollaloo, Upsala, those, we go to Fort William First Nation, and we go up to White Sand and Gull Bay in the Armstrong area, and then we go up to Geraldton, Nakina, Long Lac, and then Marathon. The worker in Marathon comes back to Pace Plat and Scriber and up to Manitowage, and then to Pick River and Pick Mulbert. So we cover a lot of territory. We're really fortunate because the Indigenous people who were the founding board of the clinic felt that it was really important to be able to provide direct service in the district, not just have an office in Thunder Bay where somebody would occasionally go out to other areas. So our agency often is the only one that is able to provide consistent direct service in a community. And so we provide poverty law services, so primarily in the areas of income maintenance and eviction prevention, housing issues, tenancy issues. And income maintenance programs, most of the government, all of the government income maintenance programs have appeal processes so that if you're not getting the benefits that you should be getting, or if you're not getting as much as you should be getting, you can appeal. And so we help people do individual appeals, but we also do more general community work, like public legal education and law reform work.
So how many staff work for Kinna?
Right now, we have some people on contract because we've gotten funding for a couple of different projects. And I think there are 14 people working in our Thunder Bay office, and then two in Marathon and 2 in Geraldton.
So it's
It's
18, I guess, altogether.
Yeah, it's not a, we do a lot with the resources that we have. We provide a lot of service, thousands of individual advice and summary advice and brief service matters, and hundreds of ongoing case files every year.
So are all the staff lawyers as well, or how
No,
does that work?
we have 3 lawyers on staff, and we have 5 community legal workers, most of whom now are licensed paralegals, but they're not required to be licensed paralegals because they work at legal clinics. And then we have our Director of Administration, Beth Ponca, and a number of support staff positions.
So you mentioned, okay, so it's poverty law,
Yeah.
income maintenance, so that people have income coming in so they can afford to live,
That's right.
and housing are the 2 main areas
That's right.
of work.
And for income security, the main programs that we're dealing with are Ontario Works and Ontario Disability Support Program. Those are the 2 provincial social assistance programs. There are a number of other government income maintenance programs like WSIB for injured workers, or employment insurance, Canada Pension, disability benefits. We do help people with employment insurance and CPP matters. But the social assistance is the bottom of the safety net, and you also often you'll find that people who are injured workers and they're not getting the benefits that they should be getting from WSIB, or people who've been fired from their jobs but they can't get employment insurance for various reasons. Those people often end up dependent on Ontario Works or Ontario Disability Support Program benefits. And those are the programs that we work with mostly.
And now I know you used to do assistance with workers' compensation or WSIB.
Yeah.
That changed. What was behind that?
Well, it was just a resource issue. We didn't have enough. We didn't have enough resources to meet the demand for WSIB. And at the time that we made the decision to stop doing that work, there were other resources in the community. So there was the Injured Worker Support Group had funding at that point for staff, and the Office of the Worker Advisor was able to help more people than they seem to be able to help now. But for social assistance, we're the only game in town. If you're not getting Ontario Works, there's nothing else out there for you. And so our board made the difficult decision to stop doing WSIB work a number of years ago.
If I recall, it was probably about 20 years ago when it was the Mike Harris government in Ontario who really was not so eager to support folks on social assistance, and that became a more contentious process.
That's right, and social assistance has been consistently eroded over the years. So there was the big cut when the provincial Conservatives came in 1995. They reduced benefits by 22.6%. So that was a really significant and difficult cut for people who were relying on social assistance. But then in the years since, there have just been small increases recently. And so in terms of actual dollar amounts, people are getting just a little bit more now in 2018 than you would have received 30 years ago. So in 1988, a single person on Ontario Works could get $663 a month. And in 1983, you could afford to pay rent on a one-bedroom apartment. You could afford to buy groceries. You could have a telephone so you could look for work and be able to have somebody get in touch with you. You could, $663 in 30 years ago was, it wasn't a lot, and there was work being done then to try to move to something of more of a market basket approach, where you actually look at what do things cost in your community to decide how much money to give people. But then there were the cuts in 95 and very little increase since then. So today, a single person on Ontario Works can only get a maximum of $720 a month. And that's less than the average cost of a one-bedroom apartment in Thunder Bay.
Right, I'm kind of going $700 a month. Can you even rent a place in Thunder Bay?
Well, you can get a room in a rooming house in Thunder Bay for between $500 and $600 a month, depending. So that does not leave you much for all of the rest of your basic needs. And it's just simply inadequate. It has been for years, and we've been telling the government that for years. And there have been some increases, but it's still far less than the poverty line. And even disability benefits. You get more if you're a person with a disability, if you're recognized to be a person with a disability, and you get benefits from the Ontario Disability Support Program. But even with that, a single person, the maximum benefit is $1,151 a month. So it seems like a lot if you're on Ontario Works, but then once you get on ODSP, you realize you're still far below the poverty line.
We need to take a short break, Sally. We'll be right back. Please stay with us. Welcome back to Community Conversations. I'm your host, Steve Mantis, and my guest today is Sally Calquhoun, the Coordinator of Legal Services at Kinna Community Legal Clinic. So Sally, you were just talking about the levels of social assistance. This is an area that the staff at Kinna spend a lot of time on.
We have, because the social assistance rates are just so inadequate. We marvel every day that our clients are able to get by on as little money as they receive. And last fall, there was a report that was released called A Roadmap for Change. And it's a report that was created jointly by 3 different groups. The Income Security Reform Working Group was appointed by the provincial government, and then also there was a First Nations Income Security Reform Group, and a third group with urban Indigenous people. And they worked separately, but then came together, and the report is joint. And it sets out, it's called a roadmap for change, and it sets out a plan for how the province can make the social assistance programs better for people who need to rely on social assistance, but also better for all of us, because there's a lot of research that shows that that the less inequality there is in the community, the better it is for your community. And homelessness and deep poverty are terrible for the people who are experiencing it, but it's also bad for your community, and it's costly to the community. So you see additional costs in healthcare, for instance, because poverty is recognized as one of the social determinants of health. If you're living in deep poverty, that's as likely as smoking to affect your health. And we all know how bad it is for us to smoke. It's equally bad for somebody to be poor in terms of higher rates of diabetes and other diseases, and actually more likely to die at a younger age.
And so what we're talking about is the inequality in income, and over the years that gap has really grown in Canada.
It has, and you know what I have been saying frequently in the last few years when I'm invited to come to pre-budget meetings for various politicians is people who are on social assistance in Ontario should get enough money to pay rent and buy food. And you know, we're talking about people who've been assessed and have done all the paperwork, and they've been found to be eligible for social assistance. Maybe they're a person with a disability and they have barriers to being employed. Maybe they have been employed, but they've lost their job and haven't found another one. I mean, for whatever reason, they need some assistance in order to meet their basic needs, and they should get enough money to meet their basic needs. You shouldn't have to be wondering, should I pay the rent or buy groceries? You should be able to do both.
And you know, from my work with folks who are in that situation, what I've kind of picked up on is how when you don't have the security of knowing you can buy food like for your kids, that kind of preoccupies you all the time. Like you're always thinking about how can I balance the money I have? How can I make sure that at the end of the month I have food for my kids, and maybe not even myself?
Yeah, that's right.
And when you're in that state, how do you move forward? How do you plan? You're just trying to make it day to day.
Well, increased mental health problems is another medical condition that is associated with poverty, and also substance use and addiction. I remember seeing a really interesting documentary that was done by the Soup Kitchen in Sault Ste. Marie, and listening to this woman talk about how you know, she thought people weren't living on the street because they were drinking. She thought they were drinking because they were living on the street, because that's one way you can cope with all of the difficulties in your life if that's what you're living with. And homelessness is really I mean, it's, as I said, it's terrible for the people who are experiencing it, but it's really expensive just for the community. I mean, it costs us more to support a bed at Shelter House than it would cost to pay a month's rent for somebody in an apartment. And it's just kind of crazy that our society has come to the point where we're supporting emergency shelters and emergency food banks, and I mean, there's a big network of food banks now, which is great because people need food security. But wouldn't it make a lot more sense just to give people enough money to buy groceries themselves? and maybe have some kind of emergency stuff instead of having this big network of food security agencies, because people don't get enough money. It's not a matter of poor budgeting or poor choices. If you're only getting $700 a month, there's no possible way that you can pay rent and buy enough groceries for a month. It's just not possible. So you are going to have to go to soup kitchens, you're going to have to go to food banks, you're going to have to figure out, and that's what people spend a lot of their day doing also. Mm-hmm. When you talk about people spending the day worrying about what's going to happen, they're also spending the day walking to the Do Drop In for $2.30, because there's one meal a day at the Do Drop In, and they know that they can go there, but they don't have enough money to take the bus. It costs, I think, $2.25 to take the bus in Thunder Bay. That means you need $5 for a round trip. There's no way that you're going to be able to do that either if you're on social assistance. You're going to spend a lot of time just getting where you need to be.
And my memory was too that when the Conservative government cut those rates by 22%, they also brought in changes to how the program was administered, which made it much more difficult for people in a number of levels. I mean, I remember if you got $50 from your parents, for your birthday, you had to declare that, and it would be subtracted from your check.
Yeah, and there have been some really positive changes in the last few years in terms of the myriad rules around being on social assistance, and recognizing that it costs a lot to have that focus on policing people's lives, and it's actually less expensive to the community to be a little bit less restrictive. And it's also easier for people who are on the system. And that's something that's a key recommendation in the Roadmap for Change. So the Roadmap for Change, the recommendations that they're making are, I mean, there's a significant recommendation about a big increase in social assistance rates so that people are getting enough money to meet their needs. But there are a number of other recommendations that deal with how the rules work on social assistance, and recognizing that there should be less of a policing aspect of it. That's something also that's being investigated in the Ontario Basic Income Pilot project. Thunder Bay is one of the sites for the Basic Income Pilot, and they're looking, it's a research project, so they're looking at how just getting a check every month, and it's actually it's almost twice as much as somebody gets on social assistance. So it's a bigger check as well. But also there are fewer strings attached to the check. So they don't care who you're sleeping with, or whether you're going to school or not, whether you're working. If you're working, you have to report your income and it gets deducted. But you only do that once a year. That you don't have to be reporting it every 5 minutes. And so
we need to hang on right there.
Yes.
We'll be right back, and we'll find out more about the Roadmap for Change and that Basic Income Pilot. Please stay with us. Welcome back to Community Conversations. I'm your host, Steve Mantis, and my guest today is Sally Calquhoun, the Coordinator of Legal Services at Kinna Community Legal Clinic. So Sally, we were talking about the Roadmap for Change. And it's trying to address a number of things. You mentioned increases in the levels of social assistance. One of the things I know for injured workers who end up falling through the cracks through workers' compensation, in order for them to qualify for social assistance, they had to pretty well divest themselves of almost all their assets.
And that is something that has been changed just recently. In the last September, the asset levels for ODSP and for Ontario Works were increased significantly, so that you're not pushing people down into deeper poverty and making it harder to get off of social assistance. There have been a number of positive changes in social assistance in the last 2 years. Child support payments are no longer deducted dollar for dollar. So if a single parent is on social assistance and the other parent is paying child support, that money is actually available to help to help the child instead of just being deducted from the basic needs. And there's a just recently in the most recent budget, another thing that they've announced is that people who are working are going to be able to keep more of the money that they earn. So right now, if you're working while you're on social assistance, you can keep $200, and then anything over $200, half of that is deducted from your social assistance. But effective in the beginning of September, you'll be able to keep $400 before anything's deducted.
That's per month.
Per month, yeah, sorry. And so that's going to help people who are able to find work to get established and get a stable place to live and that sort of thing, so that hopefully they'll then be able to keep working. And some people move in and off, on and off of social assistance. Some people only rely on it for a few months and then they're able to find work and they never have to again. Some people, it's recognized, have significant barriers and maybe never will be able to work full time. And there has to be a recognition that not everybody is going to just find a job and go off social assistance. So you need to give people the supports that they need, and then they'll have better outcomes, and then having better outcomes leads to a ripple effect in the community, where there's a reduction in the healthcare costs because people's mental health isn't as challenged, and there's improved mental health. There's reduction in emergency services, and the research is pretty robust in this area that shows that the better support you give to people who are marginalized, the less that costs the rest of the community.
And I think we know that for all of society, don't we? That
Yeah.
it's not just those that are having a hard time, but that's what we try to do for our kids. We try to give them support so that they grow up being capable adults that can look after themselves and their families. Like, it's not, you were kind of saying
That's right.
that in a way, the
Yeah.
values that permeate all of society,
That's right.
if we really apply them to
Yeah.
those in need, all of us,
Yeah.
in a way, benefit.
That's right. I can't tell you how many times I've had somebody in my office saying that they're embarrassed that they're on social assistance, and they never thought that was good, that was going to happen in their lives, and they're embarrassed, and they're saying, I don't want to be on social assistance, and but I just need it right now, and I tell them, nobody wants to be on social assistance. But we all want it to be there. We want to live in a place where people who are really vulnerable and have no other options get support from the community and are able to meet their basic needs. And I tell people, you shouldn't be embarrassed about needing social assistance. It's the same if you were sick, you would go to the hospital. The hospital's paid for with our tax dollars, and it's there for when you need it. And the same with social assistance. It's paid for with our tax dollars, and it should be there for people who need it. They shouldn't be embarrassed and stigmatized because they need to rely on social assistance.
There's so many things here that I'm thinking about, but there's a group at St. Mike's Hospital now in Toronto that are prescribing income, doctors,
Yes.
who are kind of going, it's not the drugs you need, it's
Yes.
that you need to be able to buy healthy
Yeah.
food so you can be healthy.
Exactly. It's that, somebody who's on social assistance, if their physician prescribes them with narcotic painkillers, they can get that, and that's very expensive. But they don't get enough money to buy healthy food, and they're not able to go to the complex and swim because they can't afford to do that. And so there are lots of shortfalls in terms of our social assistance support for vulnerable people in our community.
So, as I understand it, the Roadmap for Change was a report commissioned by the government
That's
that
right.
kind of is saying this is the way forward.
That's right.
Do we see our present government, or we're in an election now,
Well,
other parties taking up the same challenge, or where are we at there?
So the Liberal, the last budget did implement a number of the recommendations from the roadmap to change, not the immediate significant increase in rates, although there is an increase in rates in the budget. I haven't seen anything from the Conservative Party about the roadmap for change in the election process. So I'm not sure where they're coming through. But we are certainly, we as in people who are interested in this issue, and our clinic is part of a group called Poverty Free Thunder Bay that's been trying to raise these issues with all of the candidates for the provincial government, because it's a very thoughtful report. It had a lot of experts on the panel, including people with lived experience, who came to this consensus that this is what we need to do moving forward. So hopefully all of the candidates in the provincial government, in the provincial election, will be reviewing the roadmap for change and looking at implementing it.
Sally, we're just about out of time. If people want to get a hold of you, what's the best way to do that?
Well, they could certainly contact me at the Kinna Legal Clinic. My phone number there is 344-2478, and my email address is COLQUHOS.
We'll put it up on the screen.
Okay.
Sally, we're out of time. Thank you so much for coming on the show. And
Thanks very much, Steve.
Thank the viewers for staying tuned, and please stay safe, and see you again next week.